Mid-level eye health professionals often get sent out to remote, challenging environments. In the past, some agencies would supply an ophthalmoscope as part of the training package, but that's fallen away. And now you've got this terrible situation of qualified eye health professionals being sent out to a rural district hospital with very little equipment, if any. The real game changer is when you put the Arclight in the hands of a primary healthcare worker.
These people are doing the work of the GP, the work of the paediatrician, health visitors, everything all rolled into one. But tools like this allow them to pick up things that they wouldn't be able to otherwise.
What the Arclight can do is bring the whole process of identifying the problem to the community level, treat what can be treated there and refer upwards.
The main differences between the Arclight device, which is a direct ophthalmoscope for looking at the back of the eyes, otoscope for looking in the ears, and an anterior segment looking at the front of the eyes, is that it's cheaper. So instead of being hundreds of pounds, it's only about 10 quid.
There was huge potential to roll it out in large numbers.
Less switches, less buttons, less dials, less mirrors. There's less can go wrong. There's less things to get scratched and gather dust and get reflections off.
The torch was a standard piece of equipment for frontline health workers. And here, of course, was a solar-powered device that did away with the need to constantly replace batteries.
Because one of the problems with devices in lower resource countries is that they might be able to get their hands on an ophthalmoscope, but when the battery goes or the bulb goes, very hard for them to get hold of those consumables. And so the device then becomes redundant.
As soon as I actually had it in my hands, it was just my go-to instrument very quickly.
Simplifying the device actually ended up making the device better because it's simpler for the user.
Every piece of real estate on this device has been mined to do something helpful. It's extremely thin. That thinness, when you compare it to standard ophthalmoscopes, allows your eye to get much closer to the patient's eye. And what that means is your field of view improves. This takes the same optical model but tightens the whole thing up.
Some of the studies that have come out say that the device is certainly not any worse, and in some areas it's actually better than the more expensive devices.
And the fact that you've got your solar panel on it, even in Scotland, I don't often have to charge this if I leave it on a windowsill. It makes it a very important instrument.
You can diagnose cataract, you can see diabetes, you can diagnose glaucoma just as well as you can with other devices. And by implication, we hope then that people are good at using it and they are making more diagnoses and they are making more and better referrals into treatment centres.
The Arclight is just so handy. It's like the Swiss Army knife of ophthalmology tools.
The cost isn't a barrier. Tanzania has got a population of around 60 million, Ghana maybe 30 million. To put an Arclight in the hands of all the frontline health workers in these two countries would cost somewhere like $40,000 to $50,000.
Rotary's been involved. They've developed a global grant to deliver devices and deliver training to healthcare students across all professional groups, actually nurses, clinical officers and medical students in Malawi for the next 5 years. And that will run and become a kind of self-sustaining thing whereby we'll train trainers locally in Malawi who will then continue the training.
If you make the investment, if you provide the training and the equipment and the infrastructure, the staff will do a wonderful job producing what people call the miracle of sight. When you do the cataract operation and you take the bandage off and the grandmother sees the grandchild for the first time, it brings a tear to your eye.